The information provided is for educational purposes and is not intended to diagnose or treat any conditions. The lifestyle interventions discussed should not be used as a substitute for conventional medical therapy.
Imagine if medicine actually looked at you as a whole, opposed to looking at you as a bunch of separate systems. Dive into Integrative Wellness Radio with Dr. Nick and Dr. Nicole to learn more about the top trends in integrative medicine, to learn about what the limitations are with testing and what you can do to start your health journey. Sometimes I tend to lose myself when I'm out here. Hey everyone, welcome back to another episode of Integrative Wellness Radio. I am Dr. Nicole and I am here with
Dr. Nick.
So we are talking about, does bad vision equate to a bad brain? And I think that this is a really important topic to shed light on, because really our vision is a window to our neurological function. And we are seeing kids that are at such young ages already being prescribed glasses or even contacts. And then we're also having these young individuals with their vision declining rapidly over time. And with that being said, it's pretty much normalized. It's not necessarily being thought to be anything more than just bad vision. And when we really look at, what is controlling the eyes, we are talking about cranial nerves that come from the brain. So it really, got me thinking more about how is the vision reflective of the function of the neurological system.
Yeah, almost a third of our cranial nerves go to innervate the eyes. And it's just, it's not only looking at how the brain is stressed, but is the brain being stressed on like a toxicity aspect or neural inflammatory aspect, but it can also be stressed through just eye fatigue as well. So it's kind of looking at it multiple different ways. And then there's so many other parts that your eyes control. It's like, people come in and they have vertigo, and it's like, is that coming from the eyes? Is that coming from the brain? Is that coming from the ears? Like, where are all these things coming about? And being able to actually help people in not just one linear aspect, but looking at maybe it is biochemical, maybe it's neurological, maybe there's an emotional component to it of, what are you not even trying to see within your life that has a whole nother side of things to be able to look at. So it's like, I love working on the brain and eye
Of course,
issues.
you had to go there already.
This is what we're talking about. This is what we're talking about.
I was like, let's ease people in and not talk about our feelings already.
I have all the feelings, all 4,623 of them.
Oh my goodness. Okay, we're gonna get we're gonna get there. So so some of the big things, if you are thinking about, okay, my child is 2, 3, 4 years old and they already have visual issues, or they might have eye tracking issues, also known as a lazy eye. We need to think about, okay, is there what could be the contributing factor to that? And definitely at such a young age, we have to think about, is there something that would be stressing the brain from a biochemical standpoint? So that could be some type of infection, virus, toxicity. And it also can be due to the birthing process. It could be due to if there was forceps used, suction, if there was any type of twisting movement to the baby's head.
Just the birth in general, it's a little traumatic.
Yes. Well, 100%. Those things that I just mentioned are obviously
more traumatic.
But, there's a lot of kids that parents will say, their heads are wobbly. They don't feel like their neck is very stable. There's other kids that get torticollis when their head is cocked to the side. And then there's kids that are colic and are crying a lot. And
there's a lot of midline deficiencies happening these days.
Yeah. So, but the colic, I want to make a note about that, is colic is not just, oh, your baby just cries a lot and you were dealt a bad deck of cards. Your baby is usually crying because they are experiencing some level of discomfort. And that discomfort can definitely come from gastrointestinal issues. It can come from headaches that they cannot express because they cannot speak. So there are many things to be considered when you have a child that has that has colic. And yes, the midline deficiencies that you're talking, or defects, I should say, that has a lot to do with nutrient deficiencies that mom had when and during her pregnancy. And a lot of that goes back to folate. I know there's a lot of conversation about the genetic mutation called MTHFR, and I don't want to go very deep into that, but having that genetic mutation is one of the reasons why women become so folate deficient. And if you're folate deficient, that is definitely going to be a cause for issues in the development of the brain and neurological system. So,
and choline plays a big factor in a lot of this midline.
Yeah, so choline is another nutrient that women need. So many women are taking prenatal or a prenatal, thinking that it's covering all of the bases of their needs. But very often enough, women need more than just what's in the prenatal, because every woman is so different. So the level of folate that you need might be different than a different woman who is pregnant. Your needs for iron vary. So you really should be doing better nutrient testing throughout your pregnancy to know, what do you need more of, essentially. So when it comes to these different factors, if it maybe was deficiency through pregnancy, maybe it was a traumatic birth, maybe it has to do with some type of infection that the baby was exposed to. And you might be thinking, like, well, what infection would my baby possibly be exposed to? So if they're born in a hospital, they are exposed to a variety of different types of organisms. And that's just because it's a hospital. There are tons of bacteria and viruses all over the place, even with the proper sterilization that they use. In addition, there's also going to be different types of microbes that the baby does not get exposed to when they don't go through the birth canal. So when you have a baby who is born as a C-section, they do not get exposed to all the good bacteria in the birth canal, but they get exposed to a lot of hospital bacteria. So these are kids that have higher strains of strep and staph.
They also don't get that neural stimulation as well coming out through the vaginal canal.
Yeah, so that neural stimulation is one of the things that really almost activates the neurological function and improves the cranial nerve function as well of the eyes. So those are just some of the things that can happen very, very, very early on. But the biggest point to understand is that we have to consider, if the eyes are so compromised, then is this really a reflection of having poor neurological function?
Well, almost always. There's a component to it. Like you said, it's like, if there's floaters can be a big portion of mold toxicity. But if there's tracking issues, it's going to definitely go back to one of the cranial nerves, just figuring out which part of that tracking isn't going to happen, and then saying, is this tracking, looking at it, is functional neurology, eye exercise is going to actually help? Or is this going to actually put more of a stress onto the eye because it's coming from a toxicity, it's coming from a viral toxin, or it's becoming from just that neural impingement through maybe the spinal cord, maybe the base of the occipit's a little off. Sometimes TMJ can have a component to affecting some of the nerves. So it's like you have to be able to be a detective and really look at all the different possibilities, because you don't want to induce more of a stress of trying to help the situation. You really want to, when it comes to the brain, it's like first, be able to get all of the, take the foot off the brakes first and just allow the body to naturally heal. And then as it has more energy, then we can kind of pump on the gas.
Yeah, when it comes to also, like, if one eye is more compromised than the other, then that is going to definitely be indicative that one side of the brain is either weaker or more inflamed than the other side. So not only are you having an eye problem, but you're also now having an imbalance in the brain hemispheres, which plays a very significant role in the body function, organ function, immune system, etc. So there's a big cascade effect that happens. And as we continue to just talk about kids, there is definitely many kids nowadays being diagnosed on the spectrum, either Asperger's or full-blown autistic. And very often what you're hearing about is how these kids are having a lot of issues with eye contact. And part of this is, issues within the cranial nerves that control the eyes, but then there is other components of this that has to do with inflammation in the neurological system. And we've worked with many autistic kids or even kids on the spectrum over time, and it's really been different across the board with what these kids are dealing with. We've had one young girl who had neuroborreliosis, which is Lyme disease of the brain. There was another case of having Coxsackie in the brain. Coxsackie is the hand, foot, and mouth virus that is, somewhat common in children. There has been other cases of the herpes simplex virus being in the brain. And then there's been other cases of strep being in the brain from chronic sinus issues, sore throats, ear infections. So the neurological stress can come from a variety of different organisms, and these organisms are not uncommon. Herpes simplex virus, that's cold sores. People think that they only...
Most people that have cold sores or have HSV1 present don't ever have a cold sore.
Yes, exactly. Well, that's what I was going to say, is that a lot of people just think, oh, it just causes cold sores on the face or in the mouth. But that virus can live in your intestines. And that virus can be a culprit for Crohn's disease, because the same sores you get on the outside of your face, you can have those sores in your intestines, which technically on imaging is Crohn's disease. So these viruses are not cut and dry. They're not always textbook manifestation. They can look very different across the board. And I would say with the herpes simplex virus, that is probably the primary one that I see with kids that have eye issues that also have neurological issues when they're young.
And then just because you were talking about the gut-brain axis, especially for viruses, they travel through the vagus nerve. It's like a highway for pretty much those pathogens to travel from all of the entire gastrointestinal system to the brain.
Yeah, so the vagus nerve is interesting because it starts in the brainstem, it works its way down, it affects the heart, it controls aspects of the heart, the respiratory system, and the gut.
Yeah, too.
So you could easily have a person who's dealing with gut issues, maybe even chronic constipation, and then they're also dealing with heart palpitations, maybe shortness of breath, and then they maybe get bouts of dizziness. And that all can really come back to the vagus nerve, and it could be different organisms that started in the gut that work their way up, like Dr. Nick said. So again, when we're talking about the visual system and the neurological system, as we get older and there is more activity, now there's also a potential for injuries and hitting the head or having different types of shifts or misalignments. So you mentioned the TMJ before, which is the kind of misalignment of the jaw. And this can definitely happen gradually. It can happen from dental work. It can also happen from, some type of injury, falling on your face.
It can happen from clenching.
But also one of the biggest connections to the visual centers is hitting the back of the head, hitting the occipital lobe. So hitting the back of the head, which unfortunately a lot of kids have hit the back of their head. They've fallen, that's the nature of learning how to walk and run. So it doesn't have to be a concussion. It doesn't have to be a hospitalization status. It could just be a good bump to the head. And hitting the back of the head, which then can create issues in the base of the skull and even the neck, that actually can be a culprit behind visual issues as well.
That's one reason why a lot of times we have visual sensations with like migraines and headaches, because it's all affecting that same part of the brain, same part of the pathway.
Well, speaking of that, so when we're talking about the brain, the biggest thing for you guys to take away is that when you have migraines, when you have visual issues, migraines, you might be seeing a neurologist. When we're talking about visual issues, you're going to your eye doctor and just getting evaluated for what type of glasses that you need. If you have the lazy eye, you might go to some type of neurologist that specializes in that. or a neurological optometrist. So there's all these like segregated out physicians in the healthcare system. But when we're talking about, what can be affecting the eyes, we can definitely be talking about infections, which technically is immunology, or infectious disease. We can also be dealing with head injuries, which, you can potentially see a neurologist if you have something severe like a concussion. But in addition to that, you can also be dealing with blood flow issues, cardiovascular issues. And cardiovascular issues is a very big component to headaches and migraines. And we actually did a whole podcast on how migraines are primarily a cardiovascular problem. So I would definitely check that out. But
the poor part is most neurologists and testing that they're going to do aren't going to evaluate blood flow.
Exactly.
They're doing an MRI, CT scan, EEG. They're not doing like a functional MRI or other testing to really be able to evaluate the actual proper blood flow.
Well, that's the thing is if you have a good bump to your head and maybe, you didn't have any actual damage to the brain tissue, hence no concussion or anything like that, you could easily create misalignments in the cranial bones. You can create misalignments in the neck. You can create a lot of tension in the neck muscles. And these are the structures that are going to compromise the blood flow in and out of the head, in addition to compromising the way that the cerebral spinal fluid moves. So the cerebral spinal fluid is pretty much the fluid that your brain floats in. So from there, what's going to happen is you're going to have a decrease in blood flow, which is going to decrease the amount of oxygen getting to the brain, which then can in turn create headaches or migraines or eventually visual issues. And then if you don't have the proper cerebral spinal fluid flow, you're going to have a lot of brain fog, memory loss, because the cerebral spinal fluid flow brings glucose and it brings nutrients to the brain to give it the fuel that it needs. So all of these components can create a variety of neurological issues, but one of them is visual.
And just to add one more on there that most people don't really understand at all is fibromyalgia. So all fibromyalgia deals with chronic glial pain. So glial cells are part of the neurons of the brain, which is really like your lymphatic, your detoxification center area for the brain. There's a couple different types of glial cells, but really chronic pain is all associated with an overactivation of the glial cells, trying to detox that inflammatory aspect. So anytime that you're in chronic pain, those pain signals are just constantly firing the brain. Overfired brain increases inflammation. Inflammation, the glial cells are constantly overworking, so they never turn off. So it's kind of like that threshold of activation is just constantly there. So, and that confuses so many people with fibromyalgia. And almost every fibromyalgia case I've seen, they all have eye issues. And it's like, not that they actually have an eye issue, they have a brain issue, they have a glial cell issue, they have an inflammatory issue that's also connected to and also body pain. So it's being able to work on all the different components of that so that you can tone down the glial reaction, you can help the body calm down, you can get the nervous system finally into a parasympathetic state to slow down and heal instead of that fight or flight sympathetic state. And then also once that's down enough to be able to start inducing the proper activation of the eyes to calm down that firing, the chaotic firing of the cranial nerves. So you're supporting all those pathways at the same time.
Yeah, well, that's kind of our experience with functional neurology is when we were really learning functional neurology and we were in school, we were visiting a lot of functional neurology practices. And functional neurology is, it's practiced by many different physicians, but we were specifically observing chiropractors that were doing it. And when we were understanding like the overall big picture of the brain and the eyes, it seemed kind of silly that we were trying to strengthen the eyes in order to improve the brain. And what about the cases that the brain needed to be dealt with before you could actually correct the eyes? So it's almost like you're trying to strengthen something that is being influenced by either inflammation, toxicity, or even something structural. So we found that even at that time, being years upon years ago, it just didn't make a ton of sense. And as we started to kind of unfold the layers and understand the integration of the body, we realized that the eye exercises are very valuable, but it's all about timing.
It's not what you do.
It's how you do it. So a couple of things that I think are important, because those of you listening probably have some level of poor vision, and that's why you're listening. But when we're talking about the eyes, the major things that we need to consider is we need to literally think about the surrounding structures that can influence it. And when it comes to the eyes, the cranial nerves, and the brain, we have to consider the health of our sinuses. You know, do we have chronic inflammation in our sinuses? Do we snore when we sleep? The sinuses actually play a very significant role in how well the brain can detox. We also have to consider, have we had a bunch of head injuries? Do we have scars on our head? I always ask, do you have any head injuries? No. And then I'm like, what's that scar on your forehead? And they're like, oh, I got hit with a golf club when I was young. And I'm like, yeah, that's a head injury. So, but not only, you know, the injury in that moment, but if you have a scar, then you actually have adhesions that could be blocking, again, how well things are moving and flowing. We also have to consider how much dental work have you had. And maybe the dental work compromised your jaw, but maybe you also have a boatload of toxins in your mouth because you have silver fillings, white fillings, sealants, root canals, etc. So we need to consider all of these surrounding areas. And also, too, if you have these low-grade sore throats all the time and your tonsils are huge and you get those lovely tonsil stones, only some of you will know what I'm talking about, but those gross white things that pop out of your tonsils and smell horrid, those are called tonsil stones. And what they are a brewing ground of bacteria. And I know this very well because I used to have them. And that really, once I understood the big picture, I understood how sinuses, tonsils, the lymph nodes and glands of your neck, they all work together. And when those systems are not working at their best, your brain cannot detox properly. And even if you lead the healthiest lifestyle on the planet, your brain still needs to detox. And I say this because your body is anabolic and catabolic. So literally you're having the building up of cells, the breakdown of cells. You have cells that go through apoptosis, which kills off cells that your body no longer needs, or those cells were aged. So it's not just about like you working in a factory or being a mechanic or anything like that. It's just that is the normal process of the body. It builds up and breaks down. And the byproduct of the things that are being broken down, they need to be eradicated out of the body. So your body is equipped to detox all of these bad things out. And your brain has a very, very special system to detox. And if that system is not working properly, then you're going to definitely have a variety of issues, eye issues being one. And you can have memory loss, brain fog, short-term memory loss, long-term memory loss. Really, the list goes on.
If you wake up fatigued in the morning, your brain's not pooping.
And also, too, if you wake up with a low-grade sore throat or you wake up with a low-grade headache, that is a sign that your brain is not detoxing properly. So I know that very well because that used to be me. I used to wake up low-grade headache thinking there's mold in my house, I have a crappy pillow, we need a new bed, and
it's my fault.
Yeah, it was none of the above. It literally had to do with a lifetime of chronic sinusitis, tonsils that probably should have been removed when I was young, but tonsils that were still ridden with strep from literally when I was a child, had chronic ear infections, had mercury toxicity, not necessarily from my teeth, but it was actually from fish consumption. So I had, and I also had a head injury, hit the back of my head, huge scar, 13 staples, whiplash, I had to lift my head off the pillow. And tons of scar tissue in my neck from it. So literally it was like the perfect candidate for your brain not pooping. So I had many issues with how well my brain was detoxing. And I remember, going through points in time that I was actually concerned, like walking into rooms being like, what did I come in here for?
What am I doing?
Literally, it was scary. And literally, this was in my late 20s. And once I found out I had mercury, I was like, oh, this is it. And tried to detox from mercury and kept hitting roadblocks and just kept learning, growing, evolving, and started to realize that, there were structural components, there were scar components, there were lymph node components, there were a lot of layers that needed to be dealt with.
Should we talk about some of these therapies?
Yeah, let's go for it.
So not always, because like you said, everybody tests differently, but foundationally you want to make sure that there's proper blood flow, 100%. And that's like one of the cool things, getting down to how important, neurons need to fire. They need nutrients, and they get that nutrients not only from, like you said, the CSF, that fluid that pretty much surrounds the brain and goes through the spinal cord, stands for cerebral spinal fluid. That part, carries nutrients, so you have proper flow of that. But as soon as they drop the nutrients off, then they're pretty much acting like garbage, and then picking up all of that debris that you're talking about. Just like that, proper flow of blood. So you need increased amount of blood. One of my favorite things is infrared saunas. The saunas literally act like, it's not like your typical sauna. You walk in and it's crazy hot. You walk in and infrared, just like the sun, it heats up objects, doesn't heat up the air. So it takes about 15 minutes to start sweating. 10,
I'm laughing
20.
because it took me an hour and 15 minutes the first time I ever went into an infrared sauna to break a sweat. So when you go into a sauna and it takes you that long to sweat, that pretty much tells you your lymphatic system is not working properly.
Ain't working at all.
It's not working at all. So that's really something important, because I used to go to the gym when I was young, and I remember just not really sweating. I would only glisten, and I thought it was great. But little did I know that was reflective of how poorly my detox pathways were working.
Yeah, so infrared saunas, that heats you up from the inside out. So it's like when you're sick and you have a temperature, it's fantastic because the body's really trying to have that high temperature to really kill off these microorganisms or move toxicity around. It moves it around because anytime the body gets hot from the inside out, heat expands things. So looking at your blood flow, not only your arteries but your veins, arteries increased more blood flow, more oxygen, more nutrients. Veins is the opposite. It's really helping to get all of the bad things out. And then the same thing with your lymphatic system. So it's like your own lymphatic system was like sludge, wasn't moving. But as it finally heated up and really got that moving, that's a big component of being able to allow the brain to detox as well as get at the nutrients.
Yeah. So the infrared sauna is absolutely amazing from that component. And then when we do have patients that are struggling more so with the physical component, they either have had head injuries, they have scars on their head, they have structural problems with their neck, then we actually have a whole array of different things that we utilize.
So this might take up some time.
Yeah. So, one of the therapies that we have is called craniosacral therapy. Craniosacral therapy is amazing because the whole purpose of it is to improve how well the blood and cerebral spinal fluid is moving from the skull, the brain, all the way down into the spinal cord and even the low back. So it makes sure that everything is moving in the way that it's supposed to really activate that garbage system that Nick said. So making sure that it's cleaning up and detoxing the bad stuff out, but also delivering the proper nutrients. So that is definitely something we find some people are a candidate for when they have more of head injuries or structural issues. If that also comes from, say, scars, we actually offer something called scar release, and scar release is just, I can't even tell you how much of a game changer it is, because most people never have their scars tended to. And these scars create adhesions that create blockages for how things flow, but it also carries trauma. A lot of them carry energetic trauma, especially if, when you had that injury, it was from a traumatic experience, it was like a life or death experience. Or just a very scary experience. So helping to release the scar tissue is actually really, really significant in a lot of people.
And then if it's more neurological, coming from a structural issue, I mean, we have the chiropractic to be able to help make sure all the vertebrae is in alignment. And then looking at the cranial nerves itself, being able to do the proper eye exercises that's going to stimulate that specific cranial nerve pathway to fire. If you find as doing functional neurology, it's always, trying to do the most good with the fewest amount of exercises for the client, because, they're not going to do a lot anyways.
But we also do the exercises kind of on steroids because we will utilize a brain entrainment device. So what's really fascinating is both Nick and I, our original degrees are as chiropractors, and I think our biggest qualm with the profession was that we were, with traditional adjustments, you're not always activating the neurological system to the capacity that you can. They are activating parts of the neurological system, but we found that there were ways that you can really amplify that. And if you activate the neurological system, you create longer lasting changes. So we have actually evolved to utilizing something called neurological chiropractic. And what we're doing is we're using glasses and headphones to stimulate the visual and auditory system. So in doing that, the person is utilizing the brain entrainment device and stimulating parts of the brain through the eyes and through the cranial nerves as we work on the body, have them do eye exercises, have them do balancing exercises. So we're actually getting the brain and the body to communicate again. And we're also strengthening the cranial nerves through this process. So it's really just amazing the things that you can do that will help the eyes, but really the bigger picture is helping the brain.
Do you want me to get into emotional issues?
He's like, I've been waiting to talk about my feelings.
Do we still have time? Do we still have time?
You go for it. So Nick really wants to shed light on how the emotional component can play a role in your eyes. And this is actually very, very fascinating. So
I mean, looking at an integrative practice, it's really our job as physicians to take in as much information as possible, because you never know what that biggest void is that's causing the distress onto the person. And it's like, there's been so many times in our past that we didn't give the emotional content, the mental capacity, really enough
attention.
Yeah, enough attention. And until we really became fully encompassed in integrative, that's, I feel like, quote unquote, the magic has been happening. And it's because, like, when you look at the eyes, there's, like, metaphysically speaking, when you look at traditional Chinese medicine, it's like, it's not 100% like this, but it's like anger is stored in the liver, grief is stored in the lungs, fears in the kidneys. So when you look at the eyes, there's a component to, what are you not wanting to see in your life? What are you not wanting to deal with in your life? What's holding back?
What do you want to sweep under the rug?
Right. And a lot of times, almost 99% of something, that it's a component, because when you look at the brain, especially the limbic system that's processing a lot of that information of the emotions, it starts in the two largest areas, your amygdala. The amygdala goes in, but it's also interesting enough that for the most part, most of our information coming through our senses is coming through the eyes. So a lot of that judgment is actually being transmitted through the eyes and then being processed through the amygdala. The interesting thing neurologically looking at the eyes is that there's a very powerful direct communication between the frontal brain and the hindbrain, with the limbic system kind of being the middle aspect of that. So it's like, when you talk about a lot of these head injuries and the cranial nerves being right in back of the brain that affects the eyes, it's really the eyes bringing that communication pathway into the cranial nerves, and then that information coming up eventually get into the amygdala, processing or quote-unquote not processing well that perception, creating that emotional imbalance. So when you look...
Let's recap that. Okay. So the eyes take information in and process it through the amygdala, which is the emotional center of the brain. Let's just keep it at that.
Okay. Jeez, I just wanted to get it scientific. Keeping it simple. If you're not dealing with what you want to see, if you're living in a fantasy, or you're living through guilt and shame because of a perception that you see, it's not until honestly you work through that and you bring that perception back into balance that visual system is not going to be fully free of the stress in order to be able to, quote unquote, heal.
Yeah. Well, I think this was something that we actually had. We had a specific scenario with a patient that
was crazy.
It was literally hit the nail on the head, but we were working, there were various components, but we were working on an autoimmune eye condition. And as we dug deeper, and the patient was very open, and she described that there were some dynamics in her family based off of her culture, and it was kind of just like, don't talk about it. And a lot of it had to do with, with loyalty and pretty much cheating, put it that way. And it was something that people knew were happening, but it was just, you have to accept it, and we don't talk about it. And when we started to talk about that more, and I helped her understand that there could be a connection between that dynamic and the fact that, she was pretty much taught not to see it and not to say anything about it. She literally looked at me and was like, that actually makes a lot of sense. And we were able to take her through the DiMartini method. In addition, we did a lot of neurological work. We did craniosacral therapy. There were physical components as well. It wasn't just emotional. But she was able to have massive improvement in her eyes just from doing the different physical therapies. And then the DiMartini method was literally the icing on the cake that pretty much allowed her lab results to go into being normal. So it's just absolutely fascinating, because this is not even just about her eyes at this point. This is literally a person who her whole life has changed. Her whole mindset and dynamic has changed. She's stepping into her relationship differently. So it's really fascinating work when you're able to look at the big picture and really understand all of the components that contribute to health.
So long story short, eye issues are also a brain issue.
And we're done. So I hope that you guys understood most of this and really took a lot away. The biggest point is that, we do what we do from an integrative standpoint because nothing is linear. Two people with eye issues don't have the same thing going on. It could be caused from completely different components or reasons.
I gotta say one thing I forgot.
Okay.
No, it's just simply that being dependent on glasses is like wearing a crutch. So anytime you're wearing glasses, not saying that some people don't have to wear glasses, but when you do it, you're actually being dependent on an external source. So your eyes are going to continue to get weaker and weaker unless you're taking those glasses off and doing a physical workout for them to try to strengthen those neural pathways.
Yeah, no, I think that's really key, is that the glasses will serve their purpose, obviously, if you can't see and you need to work and drive and do all of those things. But it's being able to give your body breaks from it and strengthen the eyes, or work with someone who's going to help you strategically with strengthening the eyes. But first and foremost is figuring out, is there an underlying issue that is contributing to the eyes being out of balance? So overall, if you are looking for an integrative approach to really understand what is going on with your eyes, especially in someone who is dealing with an autoimmune eye condition, or your eyes are continually getting worse, we really want to, decipher what is the foundational reason for that. And it's looking at the physical components, the sinuses, the brain, the cranial nerves. It's looking at all of those things. And your physicians need to be understanding how many things can actually affect your eyes so that you can get the results you're looking for. So if you're looking to hop on a strategy call, definitely check out our website, integrativewellnessgroup.com, and you can learn a little bit more about our approach and how we work with our patients. All right, guys, we'll see you next week. We thank you for being a listener and subscriber to Integrative Wellness Radio. If you're looking to learn more about Integrative Wellness Group, as well as Dr. Nick or Dr. Nicole, you can check out integrativewellnessgroup.com.